On this screen in the Mouth Care module, you can listen to some common concerns caregivers have when assisting people who have dementia with mouth care. First, click on the concern quote.
Some families get upset when their family member has mouth odor, and they think we're not doing our job.
Then click on the response quote to hear some useful advice.
Lemon glycerin swabs or mouth sprays can be an easier way than brushing to improve mouth odor. But it can be helpful to explain to families that the mouth is a very sensitive area, and people who are confused because of dementia often resist oral care because it feels strange or uncomfortable or because they are fearful. Tell family members how their loved one is reacting. Explain the approaches you have tried and ask if they have any suggestions. You may learn about some preferences or habits the person had that will make oral care easier.
Some people get agitated easily when I'm helping them to brush their teeth, and I worry about them falling. So, rather than having them stand at the sink, I use a basin instead. I place it next to the person while he or she is seated. Sometimes it works, but often people seem confused, and getting them to spit in the basin is difficult.
It's best to have people brush their teeth at a bathroom sink whenever possible. Being in a familiar environment for teeth brushing can be a helpful cue. In other words, it might prompt the person to brush. Position the person either in a chair, wheelchair, or with a walker at the sink. Tell the person it's time to brush his or her teeth and hand them the toothbrush. This familiar position with a toothbrush in hand may encourage a person with dementia to actively participate in brushing his or her teeth. If a little more assistance is needed, the hand-over-hand approach is a good next step. Remember to use the CARES approach to minimize agitation and get assistance from another staff person if falling is still a concern.